What if the single most powerful tool for managing your blood sugar isn't inside a prescription bottle and never has been? What if it's something so obvious, so completely free, that every doctor in every clinic walks past it dozens of times a day without ever stopping to explain it properly? I know, you're probably thinking, here we go, another gimmick. You've heard promises before, supplements that did nothing, diets that felt like punishment, advice that sounded brilliant at the appointment and completely fell apart by Tuesday. So yes, stay skeptical. But stay right here. Because what I'm about to share has produced real, measurable drops in blood sugar for hundreds of patients in my own practice. People who were doing everything right and still struggling. People exactly like you. My name is Dr. Clarence Martin, and today I'm going to show you precisely how the timing of your water intake can improve your insulin sensitivity by up to 40%, and why nobody bothered to explain this to you sooner. Why blood sugar gets harder to control. After 60. First, let me tell you about the patients I see every single week. Men and women in their 60s and 70s who take their medication faithfully, never miss a dose. They follow their meal plans, they measure every portion, they check their glucose multiple times a day, they walk every morning, rain or shine, and their numbers are still all over the place. The frustration I witness in my practice is real. These are people who have been fighting this battle for years, sometimes decades. They've spent money on special diabetic foods. They've given up things they genuinely love, and they're tired of the vigilance. Tired of feeling like they're failing when they're actually trying harder than anyone around them. Here's what's happening inside your body after 60, and understanding this makes everything else click. 3 things are working against you at the same time. 1. Your cells gradually become more resistant to insulin. They don't open the door as quickly when insulin knocks. 2. Your pancreas produces less insulin, so you're working with fewer resources to do the same job. 3. Your kidneys filter glucose less efficiently, so excess sugar stays in your bloodstream longer. And here is the piece most healthcare providers completely miss. After 60, your brain's thirst mechanism becomes significantly less sensitive. You can be substantially, even dangerously, dehydrated without ever feeling thirsty. No dry mouth, no discomfort, but at the cellular level, things are already going wrong. Chapter 2. The 3 hydration mistakes. Almost every senior makes. Before I teach you the exact method, let me walk you through the 3 most common hydration mistakes I see in my practice. I guarantee you are making at least one of these right now. Mistake number 1. Waiting until you're thirsty. Thirst is not an early warning system. It's a fire alarm that goes off only after the fire has already started spreading. By the time your mouth feels genuinely dry, your blood has already thickened, your glucose has already elevated, and your insulin is already struggling to do its job. Think of your bloodstream as a river. When it's full and flowing, glucose moves smoothly to every cell that needs it. When that river runs low, it becomes thick and sluggish. Glucose piles up instead of being delivered. Energy drops, numbers climb. Mistake number 2. Drinking large amounts, all at once. Some people go hours without water, then gulp down a huge glass to catch up. But your body can only absorb approximately 200-250 ml every 15 minutes, about 1 cup. Anything beyond that passes straight through to your bladder without hydrating your cells at all. It's exactly like overwatering a houseplant. Dump a bucket on it all at once, and the water runs off the sides while the roots stay completely dry. Water it slowly and steadily, and the soil absorbs every drop. Mistake 3. Drinking ice-cold water in the morning. I know cold water feels refreshing, especially on a warm day, but ice-cold water causes your blood vessels to constrict and narrow. When vessels narrow, insulin has a significantly harder time reaching the cells that need it. Room temperature or slightly warm water keeps your vessels naturally relaxed and dilated, allowing insulin to circulate and work far more efficiently. This is especially critical first thing in the morning and around mealtimes. Chapter 3. The H3 Method. The exact system I use with my patients. I call this the H3 method. H stands for hydration. The first 3 represents 3 key timing points in your day. The second 3 represents 3 essential elements that make this work. Let's go through each one. Timing point number 1. First thing, every morning. This is your single most important moment of the entire day. The moment your feet touch the floor, before coffee, before breakfast, before you look at your phone, drink 1 full glass of warm water, about 350 ml, 12 Oz. Add 2 specific things. A tiny pinch of natural sea salt, just what fits on the tip of a butter knife. This provides sodium, potassium, and magnesium, which help your cells actually absorb the water rather than letting it pass through. The juice of half a fresh lemon, the vitamin C and slight acidity help stabilize your blood sugar response to your first meal. Why this works? Every morning, your adrenal glands release cortisol, your stress hormone, which tells your liver to dump stored glucose into your bloodstream. This is a major cause of high morning readings. Proper hydration with minerals calms this cortisol response, preventing that unnecessary glucose surge before you've even eaten a bite. Patient story, Elizabeth, age 72. Elizabeth had been managing type 2 diabetes for 14 years. Every morning she'd wake up to readings of 165 to 175, even after a careful dinner, even with a perfectly acceptable bedtime number. We made exactly one change: warm water with a pinch of sea salt and fresh lemon every morning, at least 20 minutes before coffee. 3 weeks later, her average morning reading had dropped to 128. Same medication, same evening routine, just how she started her mornings. I wake up feeling clear-headed now, she told me at her follow-up. And that lower morning number gives me confidence for the entire day. Timing point number 2, before every meal. About 15 minutes before lunch and dinner, drink a smaller glass of water, roughly 150 to 200 milliliter, just 1 cup. This does something powerful. It prepares your digestive system, stimulates enzyme production, and, most importantly for blood sugar, it slightly dilutes stomach contents, which slows how rapidly carbohydrates are absorbed into your bloodstream. When carbs enter slowly, your available insulin can keep up. Blood sugar rises gently instead of spiking sharply. Clinical studies show this simple habit can reduce post-meal blood sugar spikes by up to 20%. That's often the difference between good management and constantly chasing your numbers. Timing, point number 3, during physical activity. Whether you walk, garden, do household chores, or any activity lasting more than 20 minutes, you must drink water during that activity, not just afterward. Aim for 100 to 120 ml every 15 minutes in small sips, not large gulps. This keeps blood volume stable and prevents the glucose fluctuations that physical exertion commonly triggers in people managing diabetes. Chapter 4. The 3 essential elements that make it work. 1. Temperature matters. Room temperature or slightly warm water, about 22 to 24 degrees, 72 to 75 degrees, keeps blood vessels relaxed and insulin pathways open. Cold water isn't deadly, but warm water is consistently better, especially first thing in the morning. 2. Minerals matter. Pure water alone isn't enough. Your cells need minerals to absorb water properly. That morning, pinch of sea salt provides the balance they need. Use unrefined sea salt or Himalayan pink salt, not regular table salt, which has been stripped of its trace minerals. 3. Consistency matters. Your metabolic system thrives on predictable routine. Drinking at the same times every day helps stabilize your blood sugar patterns over weeks and months. Consistency is the whole game. Bonus, before bed edition. About 1 hour before sleep, drink 1 final glass of warm water with 200 mg of magnesium citrate or magnesium glycinate dissolved in it. The vast majority of people over 60 are deficient in magnesium, and magnesium is absolutely crucial for insulin function. This evening glass serves a dual purpose: deeper, more restorative sleep, and significantly more stable blood sugar throughout the entire night. Chapter 5. How much water should you actually drink? Here is the simple formula I give every patient. Take your body weight in pounds and divide by 2. That number, in ounces, is your daily baseline. Example: if you weigh 160 lbs, divide by 2, drink at least 80 Oz daily, roughly 10 standard cups. Add 1 extra cup for every 20 minutes of exercise or time in warm weather. The easiest way to know if you're on track, look at your urine color. It should be a pale, lemonade yellow, not crystal clear, which means you're overhydrating, and not dark amber, which means you're behind. Pale yellow is your target. Practical tip: use a 24-oz reusable bottle. Fill it 3 times, once in the morning, once at midday, once in the afternoon. That's 72 oz, perfect for most adults. Keep it on your counter, your desk, in your car. What you see, you drink. Chapter 6. What to expect. Week by week, W1. You'll visit the bathroom more often. This is completely normal and expected. Your body is adjusting. It settles down by week 2. W1 morning blood sugar begins to stabilize, typically 10 to 15 points lower on average. Not dramatic, but consistent. W2-3, noticeably more stable energy throughout the day. That afternoon crash becomes significantly less common. Post-meal readings become more predictable. W4. If you check your A1C, you may see it beginning to trend downward. The movement is real, even if it isn't dramatic yet. Patient story. Dorothy, age 74. I feel like I've completely failed, Dorothy told me quietly when we first met. 19 years managing diabetes, multiple medications, carb counting better than most nutritionists. But her A1C had crept to 8.6, and her endocrinologist was talking about starting insulin. She was drinking maybe 3 small glasses of water a day, mostly coffee and tea. We started the H3 method together. 6 weeks later, she walked into my office looking noticeably younger, brighter eyes, healthier skin, actually smiling. My average used to hover around 185 to 205, she told me. Now I'm consistently 145 to 165. My doctor actually reduced one of my medications. 3 months later, A1C down from 8.6 to 7.3. You gave me my life back, she said, and they were happy tears. Chapter 7. Important Notes and Safety. Let me be absolutely clear. This is not a replacement for your medication or your doctor's guidance. If you are currently taking diabetes medication, do not stop. What this method does is support your existing treatment, helping your body work more efficiently so your medications can do exactly what they're designed to do. Kidney disease. Talk with your physician before significantly increasing water intake. Most people are safe, but if your kidneys aren't filtering properly, you need individualized guidance. Blood pressure medication. Proper hydration can naturally lower blood pressure, which is a benefit, but it may require medication dosage adjustments. Watch for any dizziness and report it to your doctor immediately. Your 14-day challenge starts today. I want to personally challenge you. Try the H3 method for exactly 14 days, just 2 weeks. Follow it exactly as I've described. Warm water with sea salt and lemon, first thing every morning, before anything else. 1 cup of water, 15 minutes before lunch and dinner. Your body weight formula spread consistently throughout the day. Magnesium water 1 hour before bed. Track your blood sugar during those 2 weeks. Pay attention to your energy, your clarity, your sleep. Then come back to the comments and tell me what you noticed. Your story might be the exact thing someone else needs to finally give this a try. Dorothy's story, 19 years of struggle turned around by something that cost essentially nothing, is why I make these videos. There are thousands of people exactly like her, fighting as hard as they can, feeling defeated, when sometimes the answer really is simpler than any of us could imagine. If this video reached you today, please share it with a parent, a spouse, or a friend who's struggling with their blood sugar. Then hit subscribe so you never miss a video on managing diabetes, improving metabolic health, and living well with chronic conditions. Small strategic changes, implemented consistently, create genuinely measurable results over time. Take care of yourselves. This is Dr. Clarence Martin.